Hey guys, how are you? Wanted to share a quick update on talking to the oncologist and how that all went. So I had my scans done a week ago, or a little less than a week ago, last Friday, and they did show an increase in tumor size. There are two tumors in particular, one in my abdomen that's increased to 1.5 centimeter, and a second one, which I guess there was something kind of in my upper abdomen or lower chest. I'm not exactly sure where it is, but it has now reached 0.05. So that is kind of a new one, although the scans show that something was there before. It's just at that size now. When I got the scans on Friday, I think there was definitely a moment of like, this sucks. Like, well, I wish it was 0. And I was talking to a good friend at work who was like, well, how would it have been 0 if you didn't do chemo? And I was like, yeah, you're right. I think there's this part of me that was like, just hoping for a miracle. It's a blessing that I have the health insurance and the care where I'm getting these scans on a regular basis. They're not cheap. And so I'm grateful to have the benefits to support that and have doctors who are on top of it with me. But, when you get a scan and it's not 0, it's like leading up to a scan, I'm hardly like terrified anymore, but I would really say like low level fear or anxiety is pretty consistent all the way through. And I also had on Friday or before Friday a really bad kind of like digestive challenges, just feeling not regular. Let's just leave it at that. But that causes a lot of pain. And then if you don't rectify it fast enough, it impacts your diet because you don't want to eat anymore, and then you end up feeling nauseous. So that got pretty bad, and that was called out in the scan, but it's somewhat balanced itself since then. So that feels really good. I'm grateful for that. We talked to the oncologist on Monday, and she, similarly with me, I think I said something like, look, considering we haven't done chemo in 3 months, I would say this scan's not that bad. How do you think of it? She's like, I would say the same thing, not that bad. And that felt good to hear from her as well, that she saw it the way I saw it. The value of having measurable disease makes me eligible to do a clinical trial. So for months now, my oncologist has identified a particular clinical trial that she's just referenced a few times that could be great for me because the medicine identified or the drug in there has had such tremendous impact on the people going through the clinical trial. So she's called that out a few times. The drug has not been approved by the FDA, so the only way to gain access to the drug is to be in a clinical trial. No placebo control group required. So anyway, when we talked on Monday, we talked through a few different options. We talked about, look, if we do clinical trials, it could take 4, 6, 8 weeks before mine start. Do we feel comfortable waiting? Do we feel I need to do chemo in the middle? We talked about another drug that I could use in the meantime, which had pretty serious side effects that I wasn't sure I wanted to entertain. But I think it felt we were aligned about clinical trials, and that was really good. So next up for me is just to get some blood work done. My oncologist is going to review with her peers, which is a typical protocol, and get back to me on kind of where we go from here. There may be a laparoscopy in the middle. I know I flagged that before. We may decide we want to do that. So we're kind of in the interim. So that is done before we start the new meds. But I feel overall pretty positive after talking to the oncologist. I asked her, does she still feel it's slow moving cancer? And she said yes. And, guys, that's a tremendous gift. I mean, I am keep telling the universe I'm ready for this cancer journey story thing to be done, and I've learned what I need to. But in the interim, as I'm, slowly getting done with this, there's more work to do. There's more treatment to do, but I'm really grateful that we have space and we have some time to treat things. The other thing about clinical trials that I like is if for some reason it doesn't work, like we know the other chemos that I was taking sustain me and stabilize me. So that's an option. There is always this fear if you go to a new med that you go back to the old med and it doesn't work as well. But it doesn't mean it will happen, but that's a concern. And if neither things happen, then we go to surgery. So I think that's kind of the plan right now. And that's the big surgery that a year ago we did, but then I had to come out early because there were some challenges there. So yeah, so that's the latest. Look, could be a heck of a lot worse, and I want to focus on that. I will say, last week I was in the office for my first week in person in, close to a year, and that was extremely exhausting. And, had to sleep for an entire day to recover. And I'm only now, like a week later, starting to get some of my strength back. So, I worry whenever I have pain or uncomfortability. I think Brian worries about it too, is what's at play here. Is this about cancer? I mean, obviously the whole thing is, but is that because I have a tumor that's getting big and it's uncomfortable? Is it digestive? Is it scar tissue? All of the above. And I think when I have pain, that tends to worry me. Other thing to mention too is like dealing with chronic pain is exhausting. It's last night I worked a very full day yesterday. I worked late, and afterwards I had some really serious back pain, and it took me hours to go to sleep. And I was freaky. I thought I had kind of figured out how to avoid that by where I sit and the support with which I sit and how many pillows in my chair and those kinds of things. But this is a live ride. Like it's in real life. Like it's for real. I know you guys know this, but I think I just want to call out that because it's real, it works in a layered approach. So like if I sleep well and I wake up, I feel better. If I don't sleep well, I wake up and feel fear. If I have pain and I've slept well, I remind myself it comes with the territory. If I wake up and I didn't sleep well and I have pain, maybe I go more to worrying. Like it's a day-to-day focus. And last week when I was at work, I am stage 4, and this is the first year, you guys know, I will talk about it like that. And I'm looking it in the eye. At the same time, you forget the fact that the people you work with, thank God, aren't dealing with stage 4. I don't want any of them. I love them. I don't want any of them to deal with this, but that I really have to give myself grace and remind myself, like, this isn't a cold, this is freaking long. And it's really teaching me about patience, which is something I've always needed to learn more about. Being present in the moment, so key. When I think ahead to, if I do this new treatment, what could I don't know all those things. And so if I let my mind go there, it could really lead me down a dark place. So I guess I just share all this with you guys to say, look, here I am. You guys watch me every week or every other week when I do these, and I work really hard to reframe what's going on in my head and all those things. And even with all that conscious work, most days are hard. And I have a challenge to them is probably a better way to say it. And that I just want to share with each of you, I don't have a friend who's not going through something right now, and so your lives are equally as challenging and hard as mine, granted different, and I'm glad they are different. I don't want any of you to be dealing with this, but just to remind yourself that, they say looking back creates depression, looking forward creates anxiety, and that's why the gift of the right now is called the present. So I remind you all, stay in the present as much as you can stay in the present, and know you are in control of the story. Also, at the same time, if you're tired, rest. If you need a break, take a break. And the old work me, I'm talking even 2 months ago, if I had 30 minutes, I would fill it with something because I wanted to show I was doing my job and then some. Especially in this cancer diagnosis, some people are shocked to hear I work, but I need it, like, to just know I'm more than a chemo patient. And secondarily, I care about showing up for my team and for the people that I'm connected to, and I don't want to be considered a slacker. So, I think historically I've put myself, I've kind of pushed myself harder than I probably need to. And now I'm honoring, I'm tired, I'm not starting the next thing. So I'm going to do what has to be done, not all the things. So I hope this is helpful for you guys. Number one, you know what's going on. I know a number of you have sent me texts to be like, what did you find out? What did you find out? So that's the sum of the parts. We're sitting in a good spot, and Lord knows there are worse situations out there than mine, and I'm holding on to that, and I'm trying to manage my energy and rest when I need to rest, and ask for help when I need to ask for help, and try to be more gentle with myself. Not always easy. Us recovering perfectionists, at the base of it is shame, and no production can feel like lack of worthiness. And that's an old story, and I'm working on it. So I leave you guys all with the fact that I'm tired, but mentally feeling positive. I keep saying to the universe, I'm ready for this lesson to be done. But that's just my way of saying, let's wrap it up, folks. Let's wrap it up. And I will keep you guys posted, and we'll catch up in a couple of weeks. All right. Be well, everyone. Thanks again. For this community has just been such a support system. A number of you have texted me after my first video, and thank you for those of you who will text me and say, I wanted to ask how you were doing, and I figured the first thing I should do is watch your video. Yes, please. That's one of the reasons I do this. Is there are I'm a blessed human being to have so many people love me in this world and want to know how I'm doing. I don't really have the time nor the bandwidth to give you all the updates. So thank you for leveraging these videos as a way to do that. It's the main reason I started it, and I'm glad it still serves you. All right, everyone. I will talk to you soon. Enjoy the rest of your day, and love you so much. Be well.